Hi, I'm Nathan Young, board certified sports physical therapist with YADAYADA. Today I'm going to talk about golfer's elbow or medial elbow tendinopathy. First, I want to talk about the difference between tendinitis and tendinopathy. And so if the injury just happened, it'll be more inflamed as it attaches on the medial elbow and it'll be tendinitis. If that's the case, see my video on acute elbow pain. A lot of times when we start talking about tendinopathy or tendinosis, it's more of a chronic injury, which is more often than not that pain on that inside. It's oftentimes referred to golfer's elbow, but a lot of times it's just caused by a lot of repetitive use or gripping or moving, and you get that pain on the inside of your elbow. So today I'm going to give you my top 4 home treatments for golfer's elbow or medial elbow tendinopathy. So the first thing I'm going to talk about is stretching. And so we want to stretch that muscle on the inside, and we do that by wrist extension. And so I'm going to take my hand, push down until I feel a stretch. So as I push my wrist down, I'm straightening my elbow and my wrist, and I can feel that stretch right up on this area. If this isn't comfortable, you could also do it on a wall or a table or a counter and push up, push down into it in the same motion until you feel the stretch on there. When we're stretching, remember we want to hold for 30 seconds, and you can do 3 reps twice a day. The second thing I want to talk about is some massage. We don't want to massage right on that medial elbow. We want to drop down into that muscle and massage it. And so I do a few things. In the clinic, we can use different tools and techniques. And a lot of times we'll call this ASTM or ASTM, and we're going to get in there and work that. At home, I'm just going to use a butter knife and just use the back end of it. The second thing I like to use is some massage cream. Lotion can work, but I like cream better because it'll stay in that area and let me work on it for a while. So I'll just take a little bit of that. You don't need a lot, and just kind of apply it in that area. Then I'm going to take the back of that knife and I'm going to stretch it down through the elbow and just kind of working that and kneading that muscle out. And it should be discomfort. We're trying to bring blood flow through the area. And so when you do this, you want to do it for about 5 minutes. A lot of times you'll feel a little bit of tissue underneath it. It almost feels like some grinding or gristle in there, and you're kind of breaking that up. And so after that 5 minutes, it'll be red in that area, and that blood is helping to remodel that muscle and tendon. So we're kind of right up to the bone and working that down along that muscle belly. The third thing that we're going to do is ice massage. And so for an ice massage, you can just take a paper cup or styrofoam cup that you have frozen in your fridge, tear off the outside of it, and then you want to just massage to that muscle and to that elbow joint. So I'm just going to use a cloth here, get right up in that painful area where we have that golfer's elbow, and I want to just do small circular motion. You want to do this about 5 minutes. At first it might be uncomfortable. Oftentimes patients are saying it's aching, throbbing, but the last couple minutes it'll go numb and you won't feel much. And that's kind of what we want to get to kind of calm that medial elbow down. The last thing I want to do is strengthen. When we're strengthening tendinopathy or tendinosis, we want to do eccentric strengthening. So to talk about eccentric strengthening for my elbow, a concentric is shortening the muscle. And so for my medial elbow pain, that golfer's elbow, a concentric would be bringing my wrist up here. As the muscle touches down here, it shortens it. And so if I'm going to do eccentric, I want to lengthen that muscle. And so I'm going to show you 2 exercises that we can do to strengthen that eccentrically. And so I'll bring it up concentrically, and then slowly lowering it down, almost sometimes called like a negative. And you want to do that over 5 seconds, and then you can bring it up quickly and then slowly lower it down over 5 seconds. If it starts to get difficult, you can actually use your other hand to bring it up and then slowly lower it down 2, 3, 4, 5, and then you can bring it up and slowly lower that down over that 5 seconds. And so with the wrist flexion going down into extension, you want to do that 2 sets of 10 twice a day. The last one with it, you can use a weight and bring it this way, or you can use a hammer. And if it's too difficult, you can hold it up. If it gets easier, you can bring it down. And then you want to slowly lower it down over 5 seconds and then bring it back up and slowly lower it down 2, 3, 4, 5, and then bring it back up. Slowly lower it down 2, 3, 4, 5, and if it gets difficult, you can actually bring it back up and then you can slowly lower it down. We want to do that 2 sets of 10 twice a day. If you're still having difficulty after a few weeks, you can also progress to elbow brace. Sometimes people will apply it on the outside for a tennis elbow. If you're having pain on the inside, you'd actually make sure you get the brace and not attach it right on the elbow, but just down an inch or so in that muscle belly and get it tight enough to take the pressure or the pull off the elbow. And those braces can be purchased online or from your medical provider. If you're still not getting better, we ask you to follow up with a healthcare provider or a physical therapist. And oftentimes with these chronic injuries, I found dry needling performed by a certified therapist in dry needling can help that heal. Hopefully this was helpful. Have a great day.